May I now invite our respectable chief guest, Dr. Vardhan, former Union Minister of Health and Family Welfare.
Dear colleagues on the dais, most respected Dr. Chandrakant Panda ji, my senior colleague from my alma mater, Dr. Mohsin Wali, Dr. Mahesh Verma, and Dr. Anurag Batra, Dr. Swadeep, and all the distinguished friends, professional colleagues, ladies and gentlemen, friends from the media. Thank you, Dr. Swadeep. Although I did not get a call from you, I got it from your bigger boss. KG Suresh ji called me 2 days back, who is the director of India Habitat Center. He said this is a book about this subject and it has to be released. So I said, first you have to provide me the book, then only it can be released, because I have never released a book without reading it. I released Professor P.N. Tandon's book also, Kiran Majumdar Shaw's book also, Shiv Kheda's book also, but all after reading, not for a photo opportunity. So anyway, I'm really grateful you provided this book. And when I saw the subject, and then when I tried to read the complete book, it's a very thorough and comprehensive book in 100 pages. I have a professional career of almost practicing as a practicing ENT surgeon for almost 43 years now, in public life for 32 years now, and all these, at least these 32 years, health has been my passion. And being health minister in Delhi, also being health minister at the center, having that privilege of working with our great Prime Minister Narendra Modi ji, and also having worked with the World Health Organization as an advisor for many Southeast Asian countries for many years, and having worked for polio for 20 years and for COVID for 18 months, where all these years, in all these movements, I have fought against misinformation and disinformation against. So it was very difficult for me to really think of talking about this subject in 15 minutes. So what I did was that I wrote a couple of pages myself since morning, but before I go to them, I thought I'll just highlight a couple of things which probably many people, because all these years while working in the health sector, I fought with plague in 94. I started fighting with polio again in 94. Then I fought with dengue, which was probably the worst ever, or the first ever dengue of that nature in 96, when we had 10,000 cases in Delhi and we lost almost 423 patients. And then again I fought with the epidemic dropsy in 1998. And when this, most of us are hearing this term infodemic these days during COVID. But while I was working with WHO in the early part of this century, 2000, I started working with them in 1999. They invited me to work when my tenure in Delhi government was over. So I remember that during the 2002-2003, this pandemic of SARS, this term infodemic was first coined by Mr. David. He's a journalist, American journalist, foreign media expert, security expert, and is a young man. Not means young as much as he is slightly younger than me. So, because we all know that this, I also think that we should tell our patients that there is a chronological age, there is a biological age. So this age is only a number. So then 2014, I consider it as a privilege also to have fought against Ebola when I took charge, but we never allowed Ebola to enter India under the leadership of Prime Minister Narendra Modi. And then 18 months with COVID, so it's a very tall order to talk about, but I must congratulate you, Dr. Swadeep, because let me begin by congratulating you, Dr. Srivastava, for taking up this challenge, which is not merely, I would say, medical or technological, but this is profoundly civilizational. And I would say that how societies preserve truth, especially in moments when truth is needed the most. This is, I think, my initial comment about what you have done. And because health at its core is not only about hospitals, medicines, and laboratories. Health is also about trust. Trust between the doctor and his patient, physician and his patient, trust between the families and the institutions, and also trust between the public and the policy. And it is precisely this trust that this infodemic seeks to corrode. So this is definitely a very serious matter, and I call it the age of the infodemic, basically. We live in an age where information travels faster than infection. Am I right? Yes. A whisper becomes a headline. A rumor becomes a movement. A forwarded message with no author and accountability can travel to millions before a single expert has had the chance to respond. In earlier generations, misinformation was limited by distance. Today it is amplified by design. Algorithms reward outrage, not accuracy. Virality often defeats verification. And in health, cost of a lie is not merely reputational, it can be fatal also. When false cures spread, patients delay treatment. When vaccine fears are manufactured, immunity collapses. When conspiracy theories replace science, public health becomes a public risk. So I want to say it very clearly with utmost conviction that infodemic is not a side issue. It is not a public relations issue. it is a public health emergency. Then, as I mentioned, the various public health battles that I had the privilege to fight. In public life, I have seen and handled many battles, starting with polio, plague, dengue, epidemic, dropsy, SARS, Ebola, and COVID in recent years. And I have learned during all these battles that public health victories are never achieved by the government alone. And I will elaborate on all these points when I talk about some of them, because there are hundreds and thousands of things that come to my mind of last 30 years, 20 years of journey of polio and 18 months of COVID. Every day, every minute, every hour, there was a new misinformation and new mechanism and new way of providing or circulating a misinformation or a new. So when I say that that public health victories are never achieved by government alone, I also say simultaneously they are achieved when science, society and state, they move in alignment. India's journey towards eliminating polio is one such example. It required vaccination, yes, but also mobilization. It required cold chain systems, yes, but also community confidence. It required strategy, yes, but also relentless communication. And here I would like to talk a little bit about polio, and when we started dreaming about it, was an accidental meeting. Dr. Mahesh Verma belongs to Maulana Azad Medical College. He was principal there in the dental college. 20th of December 1993. I was only 17 days old as a health minister in Delhi. And I was invited to a function in Maulana Azad Medical College. That was their old boys function. And while I was talking like this from the stage, few doctors, very ambitious pediatricians, they sent me a small slip. They said, "We want to talk to you." And I said, "Okay, yes," I just delivered back the slip. And when I came down, they said, "Dr. Harshvardhan, we are not going to talk to you here. You have to come with us to that corner of the ground, Maulana Azad Medical College ground, and beneath a tree, they talked to me about polio eradication, the possibility of eradicating polio like smallpox. I knew about polio vaccination, but honestly not about the fact that it could be eradicated. Just like we could eradicate smallpox in the late 70s. And then they said, "We have been from Indian Academy of Pediatrics knocking at the doors of every politician, every government. WHO resolved in 1988, but there are no takers. Everything is falling on deaf ears." And this, just to cut the long story short, they spoke about this strategy. I came back home. I kept thinking the whole night about these crippled children, about the plight of their unfortunate parents. And I don't know, I always consider it as a blessing of God. I don't know how, when, at what moment in that night a dream was born to do something for polio eradication. And at that time I never thought that ever in my life I would be able to see a polio-free India at least. Because they told me that 60% of the polio cases of the whole world, they belong to India. And they said the place from where you have got elected, that is the Trans Yamuna area, it has the maximum polio cases of the whole world. So it was such a shocking news for me. And the only thing that we did was to write to WHO, get everything from WHO, and whatever I said, I just wrote one simple letter that you provide me with everything that is available in this world about polio eradication. So they sent me this much of papers. It had papers written by Jonas Salk also, Albert Sabin also, those who discovered the polio vaccine injectable as well as the other one, and experiences of many countries, Brazil, Cuba, Iran, Philippines, this, that. It took me 10 days. And journey started with a core group meeting of 4 people in my house in Krishnanagar, 2 pediatricians, a childhood friend who was a management expert, and the health secretary. And while I brought the tea for the 4 people from my kitchen, the health secretary told the other 3, नए नए मंत्री बने हैं थोड़े दिन में. I have written all these accounts in my book, A Tale of Two Drops. But anyway, the journey started from there. And the journey from there, which started on 20th December 1993, finished from my point of view on 27th March 2014, when WHO declared India as well as the Southeast Asia region certified polio free. And I was fortunate enough that by that time I had become the Union Health Minister also. They presented me with that certificate of this thing. But I am not telling you this for this applause. But the point that I want, that while we were preparing for this, I am telling you the negative sides and the positive sides also, because that gives us an insight into the future of how we handle all this. So while we had almost completed our preparations, we were into September. Our first pulse polio in Delhi, if you can recall, was 2nd of October 1994. And somewhere in September, we had this plague in Delhi as well as Surat, as well as in some other places in India. There was so much of rumor mongering, there was so much of fear. Everybody, including the World Health Organization, they in fact requested me, including my Chief Minister, Mr. Madan Lal Khurana, the late Madan Lal Khurana, that Doctor Sahab, please इसको इस समय postpone कर दो, डेट postpone कर दो इसका, क्योंकि ये अभी कोई, सब लोग बोल रहे थे कोई लेकर ही नहीं आएगा. तो उस समय के मैं 3 इंसिडेंट्स आपको बताना चाहता हूँ कि हाउ मीडिया का पॉजिटिव एस्पेक्ट भी है, मंत्री दूसरी पार्टी के उनका पॉजिटिव एस्पेक्ट भी है, नेगेटिव एस्पेक्ट भी है. इस कैंपेन के दौरान आई हैड कॉन्टैक्टेड hundreds and thousands of people, and I went and contacted the Union Communication Minister, Information and Broadcasting Minister. He was a Congress minister. Although I could never get an appointment with the Prime Minister at that time, but I got an appointment from the Information Broadcasting Minister. I explained him, India is home to this, that, and everything is not happening. Anywhere, nothing is happening. Next day he said, you please tell me what is required of Doordarshan, because that time Doordarshan was the biggest this thing. I just said this is the only way to reach people, and we need help from you. And he said, "You don't have to come here again." The very next day, he said, "All my officers will go to your office." At that time, all of you must have heard about Mr. Naveen Chawla. He was the Joint Secretary there, and Mr. Pahadi was the Doordarshan director. And they, along with their Chief of All India Radio and all, they came to my office. And from that day till the next couple of years, we used to send messages to All India Radio, Doordarshan, Mr. Pahadi also, or whatever we wanted. And you must be recalling that we got this huge publicity regular. I was talking on the Doordarshan, conveying this message. And then the second great thing, how the media can be so great. There was only one TV channel at that time. That was Zee Television. We went to the Goyals who were owners of Zee Television, explained to them that a country like Brazil has already eradicated polio. It is a much more difficult country and we are struggling and we have hardly done anything. They also promised, as long as you keep writing to us, you will not believe that Zee Television signal was going at that time in 50 countries. And we made a spot with the help of Shatrughan Sinha and Shabana Azmi. And then this spot, Zee Television also released on the media. They got a writ petition from a Arab country because it was saying that please take your children to the polio kendra, and this was being relayed in 50 countries. They said, "Don't worry, Doctor, we will fight it out." And I have written in my book also, when we calculated how much of ad they must have given to us on their television, it was worth 63 crores. You can imagine in the 90s how much is 63 crores. And they did not charge even 63 rupees for that. And when this plague came and everybody was saying, now I tell you the power of innovation, because these days we talk very much about innovation coefficient, we talk about ideas, economy and all those things. That time, when I refused to postpone the program, we were brainstorming on how to ensure that the mothers will take the children to the polio kendra. So out of the brainstorming came a brilliant idea. We got in touch with the Director Education, then also all the Deputy Directors of Education, through them all the principals, and 7 days before 2nd of October, that was sometimes around 25th of September or so, we held that big meeting with them and said, the only one small thing you have to do, give every child a small homework on 30th of September, that he has to go to his neighboring houses and write the name of 10 children who are less than 3 years of age. That time we gave 3 years vaccine, later it became 5 years. And the teacher should ask in the class by raising of hands, did you bring the name of those 10 children? And then the next day, just remind them that you have to go to these children's mother and ask them to take them to the polio kendra. And then again on 3rd October, ask again, did you do your homework? You will not believe that we had a child in Mangolpuri who wrote the names of 346 children. And the whole day he was most of the people don't know the contribution of this. This is the, in spite of adversity, in spite of the plague, and then proactively we were sharing. That is another important part of this, that from the government side, the people have to be very, very proactive. I can see some journalists here also, journalists of that time also I can see here. We were every day informing every bit of the plague thing also, of the movement. And then I give you another example. We could successfully do it in Delhi. Next year we could, that's another long story, not sharing it here but just mentioning, because there appears a big news when we were doing the national program. A big news in a national daily, front page, first news, 8 children died of polio vaccine in Maharashtra, in West Bengal. This was a front page news of a leading daily. I will not mention the daily here. We called the reporter. When we investigated, we found that since the polio vaccine was being given along with the measles vaccination, this was a case where a measles vial, which has I think 20 doses to be given to 20 children, was a vial which was used one day and then again it was used after some days. So there was the deaths were due to that. But it caused so much of harm to the whole national program. A small mistake or a small careless attitude or a small casual attitude or the rush to become popular and all. So, and then again, rumors. We talk of rumors today. It is not only the COVID where every day there was a rumor. Towards 99, 2000, Dr. Mohsin Wali is here. I don't know from where it started. Muslims in this country, they thought that this vaccine is, these 2 drops, they are causing impotence. And suddenly we saw that the cases in India 2001, 2002, they started rising. I myself, as a WHO advisor for Southeast Asian countries, was not only visiting the Southeast Asian countries, but I was asked to visit places like Meerut, Moradabad, Azamgarh, Badaयूं, and Patna, and places in three states, UP, Bihar and West Bengal. They were all the sufferers. And this was such a big, you can say, setback, that when Prime Minister Atal Bihari Vajpayee went to US in 2002 or so, President Clinton spoke to him about this, because India's program is helping, or it is the whole world's polio eradication is ultimately getting affected adversely or positively by this. And when Atalji at 12 in the midnight came back from US, we were there all there to receive him at the airport. He mentioned at the airport specifically to me, डॉक्टर हर्षवर्धन, ये पोलियो के बारे में तो क्लिंटन महाशय भी, आपके पोलियो के बारे में तो क्लिंटन महाशय भी मुझसे बात कर रहे थे. एंड देन वी केम टू नो दैट इट वाज ऑल बिकॉज ऑफ दिस सेटबैक. सो ए स्मॉल रूमर, एंड देन all these places, Dr. Mohsin Wali, I along with the WHO people, we met the imams in all the mosques. In Delhi itself we involved 3,000 mosques, and we got a poster, beautiful poster, appeal from the Prime Minister Atal Bihari Vajpayee, which was put all over. So the point that I am trying to, with these one or two examples that I am saying, that there are both, and in all these moments we have found that in spite of whatever misinformation, disinformation, malinformation, etc. may be there, if the system is proactive, if you are actually sharing everything with the people, and the people at the top, they start conversation with the society, then there is a very strong possibility that this infodemic and other things may not cause harm. This is exactly what we were doing in COVID also. Every day there was a new misinformation, we were fighting it, but every day we were also providing information at 3 o'clock. Every day I was talking to the media. I was head of the group of ministers, and we were directly conveying things. Prime Minister was directly conveying things. I come back again to my papers. As I was mentioning about this, we started with this polio thing. So I say that every vaccine campaign has two fronts. One is a medical front, the other is a informational front. And it is often the second front that determines whether the first succeeds or not. A child is protected not only by 2 drops of oral polio vaccine, but also by parents' belief that the drop is safe, necessary, and beneficial. That's why I say public health is as much about persuasion as it is about provision. I mentioned about there are so many data about, you see, I was trying to find out the data about health misinformation posts. So I found that for vaccines there are 1 to 51% posts. For COVID-19 they were 0.2 to 28.8% posts. For the pandemic there are 4 to 60% posts, means different when you put different data. And 20 to 30% of YouTube posts on emerging infections, they are thoroughly inaccurate and misleading. So this is the level which we are actually fighting. But there are, if you put on the Google good public health influencers or public health podcasts, so there is a good amount of list of the good, called good by Google, and they are really worth it. They have to be, I think, promoted in a big way. In COVID, we had to, in fact, we started this aggressive publicity where we started even a Twitter seva. We started every day. We had to create another department which was a fact check department of PIB. Every day there was a PIB press note, and there was another press note which was a fact check, if all of you remember. And then I myself started this Sunday Samvad during that period. There are a lot of things that and this that because of the misinformation and all, now polio front we are having this in Pakistan and Afghanistan only. In Pakistan itself, can you believe it, 200 polio workers and those who are moving with them for their security, they have already been killed because of various types of misinformations that have been spread. Some relate to the killing of Osama bin Laden. There is no doubt that there was the role of polio workers in that. But the polio workers who are trying to finish polio in Pakistan and Afghanistan, they are actually suffering because of all this misinformation and all. Then a bit about, I talk about the COVID-19 movement. When the world stood still, then came COVID-19, an unprecedented global crisis that shook the world's best systems, challenged the strongest economies, and tested the resilience of every nation, rich or poor. It was not only a pandemic of disease, it was a pandemic of fear. People were anxious, isolated, and overwhelmed. Families were grieving. Healthcare workers and frontline workers were risking their lives every day. Governments were forced to make decisions in real time, often with incomplete information because the virus itself was evolving. And alongside the virus, another contagion spread: misinformation, about which we are all here. You see, can we ever think of having a conference about misinformation? We have been forced to have a meeting of such great doctors about misinformation. So that sometimes we feel that those who are providing this misinformation, they are quite successful, at least, or maybe they have. This could be a blessing in disguise for that. Misinformation is a blessing in disguise for us. And alongside the virus, another contagion spread: misinformation, fake miracle cures, falsehoods about vaccines, panic stoking rumors about hospitals, sinister conspiracy theories about the origin of the virus. Still not clear कहाँ से आया ये virus. Dangerous advice passed off as home remedies that cost lives. And in those months, every health system confronted a crucial truth: a society cannot fight a pandemic if it cannot trust facts. India, with its vast population, diversity and density, faced challenges on a scale very few countries can comprehend. Yet, what helped us navigate this difficult period was not just infrastructure and policy. It was also communication, daily briefings, scientific advisories, consistent messaging, and a broad effort to reach citizens in many languages and formats. This is what I mentioned just now. I am not here to claim that the world or India had all the answers. No one did. But I am here to underline something essential. In a crisis, the quality of information becomes as important as the supply of oxygen. There have been many misinformations. I remember that misinformation and fake news have enveloped every conceivable aspect of COVID-19 in India. Because when I look back, whether it ranges from origin, causes, diagnosis, transmissibility, lethality, prevention and cure, lockdown measures and vaccine efficacy. All aspects had everyday new misinformation, basically. One of the leading Hindi dailies, their article claimed that Government of India has admitted that COVID-19 vaccine poses a risk of paralysis and other neurological disorders, which was totally misleading, totally baseless and not supported by any scientific evidence. There were so many misinformations about this vaccine, misinformation from another data, misinformation from politicians, celebrities and other public figures accounted for 69% of total social media engagement. This is from the politicians and the hi-fi people, film stars. But I have a good story from the film stars also. Polio, I remember many film stars. I remember many cricketers, the great Kapil Dev and his friend Kirti Azad and many other cricketers, many senior directors. I remember Subhash Ghai came to me and he said, "Doctor Sahab, you tell us, we'll put the whole industry together and we'll get you a polio spot which can..." Means there are the... and I have a knowledge which I will not share about some of the film stars and some of the greatest players and who said nothing can happen pro bono or without money. So then I want to again congratulate Dr. Srivastava. You have mentioned about this information therapy. Information therapy, IX. That is why the concept at the heart of Dr. Srivastava's work, information therapy, is so important. IX is a deceptively simple idea. The patients and citizens deserve not just treatment but trusted, structured, evidence-based information delivered ethically, compassionately, and consistently. In many ways, information therapy is the missing bridge between the clinic and the community. A doctor can prescribe medicines, but if the patient is flooded with contradictory messages online, the prescription may not be followed. But if the public is, a government can issue guidelines, but if the public is exposed to misinformation that appears more emotional, more sensational, and more shareable, the guideline may not be believed. IX recognizes that we must treat misinformation not only by debunking it but by preempting it with credible clarity. And I must appreciate that this book does not merely diagnose the problem, it seeks to offer a framework and a pathway. Congratulations, Dr. Srivastava, again. Then I have written a page on who must act, that is the shared responsibility. The infodemic can't be solved by one stakeholder alone. Doctors and hospitals must communicate beyond the consultation chambers through public outreach, patient education, and accessible digital resources. Media organizations must value accuracy over speed, content over clickbait, and science over sensation. Technology platforms must accept that they are not neutral pipes. If they can amplify content, they must also take responsibility for its consequences, especially when harm is foreseeable. Government and regulators must create enabling frameworks that protect free speech while preventing deliberate malicious health misinformation that endangers lives. Citizens must develop what we might call information hygiene, the ability to pause, verify, and think before sharing. In earlier times, we used to teach our children, wash your hands before eating, right? Today we must also teach, verify your information before forwarding. Then what could be the national mission? That is health literacy. India's strength is its people, but that strength can only be realized when citizens are empowered with knowledge. We need a national movement. I have always been a strong advocate for a social movement for health because I have always believed that it is the positive health attitude that needs to be developed. Prevention is 90% of health, therapeutics is only 10%, but we are putting 90% on the therapeutics and not ever educating people about prevention. Health literacy must become part of school curricula. It must be reinforced through community health workers. It must be disseminated through radio, television, digital platforms, local languages, and it must be designed for real lay people and not for experts. Because misinformation thrives where there is confusion. Truth thrives where there is trust and where knowledge is accessible. Then a few lines about the human cost of misinformation. Let us not forget, behind every rumor is a human being. A mother who delays immunization because of fear, a patient who stops medication because a viral post frightened him, a family that spends the savings on quack cures, a young person trapped in anxiety because of alarming misinformation. And this is not abstract. The infodemic is not a debate for studios only. It is a battle for lives, and in that battle, every responsible voice matters. Then I am telling you just two small stories in 1 minute each. The name of one story is the WhatsApp Oxygen Run. It's late evening. A middle class family group on WhatsApp is buzzing. Someone on WhatsApp forwards an urgent inside update. Oxygen will run out in 48 hours. Hospitals will stop admitting. Buy cylinders now. Government is hiding it. The spark. How misinformation travels. The message has all the tricks, bold caps, fake doctor signature, and a line that says, forward it to 10 people to save lives. Within hours, it leaps from one society group to another. The cascade, how panic becomes policy problem. A father with mild symptoms panics. He sends his son to arrange oxygen. The son finds a dealer who says cash only, charging 10 times. They buy a cylinder just in case it may be required. So do hundreds of other families. The damage, what it breaks. Home hoarding drains cylinders away from the people who actually need medical oxygen today. Black markets explode. Bad actors profit. Hospitals get flooded by people who do not need admission but are terrified by a forwarded rumor. Doctors spend time calming panic rather than treating patients. Real supply chain managers are fighting two battles: oxygen logistics and misinformation logistics. Then there is another story. This is an international story. You can all check on the internet also. When a rumor burns a tower, many of you may not be knowing about this, these aspects. When a rumor burns a tower, a conspiracy theory begins online. 5G spreads COVID. It sounds technical enough to confuse, dramatic enough to travel, and angry enough to recruit believers. The spark. Memes, edited clips, fake expert threads. Then someone says, if the government won't stop it, we must. Then the cascade. A small group vandalizes telecom infrastructure. In some places internationally, mobile phone masts were attacked amid 5G COVID conspiracy beliefs. Then the damage. Connectivity drops. People can't reach helplines. Hospitals struggle with communications. Frontline coordination gets harder. And frightened communities feel even more abandoned. The punchline. An infodemic does not just misinform minds. It can physically damage the infrastructure we rely on to save lives. The punchline, the virus attacks lungs, the infodemic attacks judgment, and why judgment collapses. And when judgment collapses, even the best systems begin to look like they are falling. As a minister, I am exhausted. Briefing people, telling agencies to dispel this disinformation, giving interviews to media and especially TV channels. Precious time in which more productive things could have been done, is now lost, and we have no control because the panic spreads faster than what we can control. Then the final conclusion, why this book matters. Dr. Srivastava, this evening is not merely about launching a book. It is about launching a conversation and I hope a commitment. A commitment that truth will not be left defenseless. Truth will not be left defenseless. Science will not be drowned out by noise. Public health will not be sabotaged by profiteers of panic. Dr. Srivastava's book arrives at a moment when the world is still processing the lessons of COVID-19 while preparing for future health challenges. Whether pandemics, antimicrobial resistance, environment and climate linked diseases, or new waves of digital misinformation. I congratulate the HEAL Foundation and the India Habitat Center for recognizing that the health of a nation depends not only on hospitals and doctors, but also on the integrity of the information system. I pray this work reaches clinicians, policymakers, journalists, medical students, and citizens. May it strengthen the cause of truthful communication and in healthcare. May it serve as a practical tool in protecting lives, because in the end, accurate information is not merely knowledge, it is core. Then a few slogans that I also wrote. In every pandemic, misinformation is the second pathogen. This is my slogan number 1. Swasth Bharat needs Satya Bharat. जो सच नहीं वो शेयर नहीं. Authenticate before you amplify. Let's move from viral content to verified content. Am I right? The next wave we must stop is the wave of lies. This is a book for the age where lies spread faster than viruses. Truth is public health. This book is a call to action. मेरा तो ख़त्म हो गया. अब इनका जो इसमें मैंने वैसे बहुत चीज़ें, इस किताब में बहुत चीज़ें मैंने मार्क की हैं, लेकिन मैं सिर्फ 2 पैराग्राफ जो आखिरी चैप्टर के वही पढ़ता हूँ. मतलब वो एक तरह से शायद उसमें से कुछ इनकी भाषा में क्रक्स निकलेगा. ये लास्ट चैप्टर है, द एम्पावरिंग अवरसेल्व्स इन द एज ऑफ इंफॉर्मेशन ओवरलोड. इसका 3rd पैराग्राफ है, उसका हेडिंग है द डबल ट्रबल वायरस एंड मिस इन्फॉर्मेशन ए क्राइसिस मल्टीप्लाइड. द वर्ल्ड हेल्ड इट्स ब्रेथ एज ए टीनी अनसीन एनिमी, द कॉज ऑफ ए ग्लोबल पैंडेमिक दैट वुड ऑल्टर द कोर्स ऑफ हिस्ट्री cast its long and formidable shadow across the globe. But along with this tangible health threat, this biological adversary that tested our physical resilience, emerged another equally insidious and far-reaching, a silent spreading pandemic of misinformation and infodemic that mirrored the virus in its rapid and pervasive spread, infecting minds as the virus infected bodies. फिर इसी में एक और अगला पैराग्राफ है, फाइंडिंग आवर वे टूल्स of reason and promise of hope. But in this overwhelming flood of confusion and uncertainty, we also began to discern glimmers of hope, rays of light piercing through the darkness of misinformation. We envisioned a future where our societies are more resilient and better equipped to handle such crises, built on the strong foundation of global collaboration, shared knowledge, and unified action. Artificial intelligence, once a concept confined to the realms of science fiction, stepped onto the front lines of this information battle, offering powerful and sophisticated tools for automatically detecting, flagging, and combating the rapid spread of misinformation across digital platforms. And this last 2 paragraphs, the journey we have undertaken together through the pages of this book has been more than just an exploration of the challenges we face. It has been a powerful call to arms, and urgent invitation to each and every one of us to become active and responsible participants in the vital task of safeguarding truth in an era characterized by an unprecedented and ever-increasing flow of information. Let us all embrace this profound responsibility with unwavering dedication, for in doing so, we not only empower ourselves to make informed decisions that benefit our own well-being, but also equip future generations with the essential tools they will need to navigate the complexities of our rapidly changing world with clarity, confidence, and a shared, unwavering commitment to a healthier, more informed, and ultimately a more truthful tomorrow. So once again, congratulations, Dr. Srivastava, and we all hope that this will go to the masses. I will also write to people to read this book. Thank you so much.